now it is 9:24, and it would be great if parents no longer had to worry about their children developing a life-threatening allergy to peanuts. These days, pediatricians and allergists agree that feeding small amounts of peanut foods to infants at the right stage of their development can have life-changing effects. And Dr. Reena Mehta joins us this morning. And, we hear a lot about peanut allergies, and we hear a lot about all the issues that peanuts can bring. But is it as simple as just kind of introducing peanut butter or peanuts to young people?
It really is that simple. And so, we've seen a trend and a rise in the amount of food allergies that pediatric patients have, specifically peanuts and other allergenic foods as well. And so the question becomes is, why is this happening? And so the thought is that previously our guidelines recommended delaying introduction of these allergenic foods until kids were about 1 to 3 years old. And then what we ended up finding was that we have way higher rates of food allergy than we've ever had before. So somewhere around 2008, we started looking at the data and saying, well, why is this happening? And what we've realized with time is that we're actually delaying introduction. So now new studies have showed that if we introduce peanuts and other allergenic foods to our infants somewhere between 4 to 6 months of age, we can actually reduce the chance of these patients having peanut allergy.
Very interesting. But when it comes down to it, if I'm at home with my 6-month-old and I want to give, the baby some peanut butter, I would be maybe afraid, what if the baby has a reaction, or what if something happens where, what do you do? I mean, so how do you introduce it safely?
Well, that's where you're typically under the care of an allergist or your pediatrician when you do something like this. So if you are at high risk for a food allergy, meaning that you have a strong family history of food allergy, or you have severe eczema or other concerns, then you should be doing it under the care of an allergist or discussing it with your pediatrician. But typically speaking, if you are without those risk factors, introducing it between 4 to 6 months of age is generally very well tolerated and a safe thing to do. Really, the goal is to try to get in these allergenic foods before 1 year of age so that we can actually prevent the onset of peanut allergy. And so, we changed our guidelines in 2016, and now it's widely accepted by the American Academy of Pediatrics and other allergy institutions that we should be introducing these allergenic foods early. So now we've been doing this for about 5 years, and there was a recent study that was published about 1 month ago it was from Australia, and what they did is they looked at several thousand children where they actually did this early introduction of peanuts to see, in the real world, are we actually making a difference? And what they found was that there was a reduction of peanut allergy by about 16%. And so while, the trends of peanut allergy were still high, we are going in the right direction where we're actually preventing the onset of food allergy in infants before it were to actually happen.
Wow, that's amazing stuff. I mean, you hear so many people with peanut allergies and just how, anxious people can get. But that's a great way of kind of testing it out and, maybe I would say building a little immunity to it, or toleration, as you mentioned.
Well, that's exactly what it is. I do a lot of this in my clinic where I'll see young infants. And the thought is that if we can get these allergenic foods early, we can actually prevent the onset of food allergy. I mean, it's pretty remarkable. These would be children who would probably have lifelong food allergies. But if we're proactive early on, we can actually make a difference where they can tolerate these foods before they ever get allergic.
Dr. Mehta, thank you very much. Great information there, and great strides to make sure that a lot of kids don't have those allergies.